Hernia is a weakness or a gap developed in the muscles in the abdominal wall or the groin area, and it leads to a formation of a bulge which the internal organs can push through. Usually a swelling that is visible to the patient and a pain in the area where the hernia developed. And this is usually felt the most when the patient is doing things up and about and during exertion or sporting activities. The hernia is usually developed at the site where there is an inherent weakness, the commonest site being in the groin, where we all have a small gap in the muscles in the groin area that we all born with. And over time, if the other issues develops along the line, like weakness in the tissue, previous surgery in the area, that all can makes the weakness bigger and causes the internal organs to push through. Also, hernia can develop at the site of an old operation scar as well, and that's called incisional hernia, and that's usually as a result of the tissue hasn't healed properly following the surgery. Hernias commonly do present in an elective way, whereby patient notice the pain, the bulge, and they come forward with their symptoms. And that's when we discuss with them the option of a planned surgery. The planned surgery option involves either an open operation. Unfortunately, surgery is the only treatment available for hernias. Other methods has not proven to be effective, like physiotherapy or muscle exercise. They don't cause hernia to heal. Surgery involves repairing the gap, reinforcing it, usually with a mesh, and that hernia repair can be done using the traditional open surgery, where there is a long incision made over the hernia site, or the new technique of using the laparoscope or the telescope or the keyhole technique, whereby we use a long tube attached to a camera and repair the hernia through a very small incision. And in the setting of emergency, obviously that's a different ball game, where if hernia caused the internal organs to strangulate, where the blood supply suddenly cuts off, that requires an emergency surgery, and that would be immediate, and usually done using the traditional open surgery technique. Recovery, most of the hernia repair that is done in the planned elective way are done as a day surgery, whereby the patient comes in, have the surgery and go home the same day. Patients, depends on the type and the technique used to repair the hernia. Patients usually will have some pain and discomfort in the first few days. We would recommend patient would not drive in the first 4 to 7 days after surgery, and then usually by the end of the second week, most of the patient will be returning to usual activities. And here depends obviously the technique used, laparoscopic or keyhole surgery, which we use the most for repairing the groin hernias and the incisional hernia. It tends to be associated with less pain and usually quicker recovery for the majority of patients.